Okay, let me make sure I'm all hooked up and ready to go. Can you hear me in the back? Is this loud enough for all of you? Okay, great. Well, first of all, I want to thank Carol. I'm very pleased to be here. And I want to say good morning to everybody. What I'd like to do today is share with you some of our findings from our research that's looking at whether or not there are benefits to standing up and moving more. Now, I think most people have heard or read that physical activity is good for them, right? However, it's difficult to engage in enough physical activity on a consistent basis for health benefits. It's been estimated that anywhere between 40 to 80% of individuals in our population do not meet guidelines. Now, what guidelines am I referring to? Well, over the years, there have been guidelines that have been issued by various organizations, but it wasn't until 2008 when the U.S. Department of Health and Human Services actually published physical activity guidelines for Americans. And what they did when they published these guidelines is they looked at the research that had been conducted on the effects of physical activity on health outcomes. And so this publication summarizes the benefits of physical activity on various health outcomes, but they also decided to take it a step further and issue some recommendations for how much physical activity is needed in order to gain health benefits. If we look at their recommendations, what they indicated is that individuals need at least 150 minutes a week of moderate intensity aerobic activity, like biking, swimming, walking, that type of activity. If you prefer higher intensity activity, then you can cut this number in half and perform 75 minutes of aerobic activity per week in order to gain health benefits. So this is the aerobic exercise guidelines or recommendations, but they also took it a step further and included muscle strengthening activity, for example, lifting weights. And the recommendations indicate that you need at least 2 days of muscle strengthening activity for health benefits. They also broke down the recommendations by age groups, and they had specific recommendations for the different age groups. And if we look at adults 65 years and older, it included the same aerobic exercise recommendations, the same muscle strengthening recommendations, but they also indicated that those with poor mobility should perform physical activities to enhance balance and prevent falls. So those were the guidelines that were issued in 2008. However, there's been an update to the guidelines that was published in 2018. And what the advisory panel did is they looked at the research that had been conducted in between 2008 and 2018, and they could make some updates in the recommendations. And primarily the changes or the updates included information on the benefits of physical activity for brain health, physical function, and sleep. And they reaffirmed the previous recommendations on how much physical activity is needed for health benefits. So again, the 2018 recommendations include 150 minutes of moderate intensity aerobic activity. That's activity that gets your heart beating a little bit faster. Or if you prefer more vigorous exercise, like running, for example, 75 minutes a week of vigorous physical activity. And they kept the muscle strengthening exercise, indicating that the research that had been done between 2008 and 2018 reaffirmed the benefits of this level of activity. However, they also tracked whether or not physical activity levels increased during that time. And the trends for individuals meeting the physical activity guidelines did not change over the 10-year period. However, time spent in sedentary activities had increased significantly. Okay? And so they added a new recommendation. And that recommendation is move more and sit less. In fact, they even published a companion paper to the guidelines, the advisory committee did, focusing specifically on sedentary behavior and health. And so they summarized the research evidence looking at the consequences of sitting too much or looking at the consequences of too much sedentary behavior. Now, what is sedentary behavior? Okay, it's participation in activities that do not substantially increase energy expenditure above resting levels. So that's sitting, lying on the couch during waking hours. And it is an activity that we really do not think about much, except when we're prompted to think about it. Okay, so it's something that we just kind of do during the day without really thinking about it. If we look at sedentary behavior and where it falls on the physical activity continuum, at one end of the continuum is no activity, sleep, okay? At the other end of the continuum is high levels of physical activity or vigorous activity. If we focus in on sedentary behavior, you can see it's on the low end of the physical activity continuum. And there are consequences to sitting too much. There's been research looking at the relationship between sedentary behavior and health outcomes. And what we've got really good evidence for at this point in time is that sedentary behavior is associated with premature mortality, early death, some cancers, diabetes, obesity, and weight gain. And what really surprised me about this information is this is true even for those who are physically active. Now, the worst health outcomes occur for individuals who are not physically active and sit for most of the day. The best health outcomes are for individuals who are physically active and do not sit much during the day. Most of us probably fall somewhere in the middle. Okay, so there are health outcomes or there are health consequences for sitting long periods during the day, even if you're physically active. And I think this might show us why. I really like this colored picture because what this is showing, this is a woman who wore an accelerometer to track their activity. And we can wear things either around the waist or on the thigh that can track our physical activity levels as well as the intensity of the activity. And so this woman wore an accelerometer for a whole week, Monday through Sunday. And if you look at the activity counts on here, sedentary behavior is indicated in the, is that blue or is that purple? Purple is indicated in the purple, with higher intensities of activity indicated as you go up this scale. So this would be vigorous, moderate to vigorous activity. And so if we look at her activity levels once she woke up, you can see there are some days where she's got red boxes that indicates that this woman was actually meeting the physical activity guidelines. Okay, so she had physical activity sessions that she did during the week, but look at the purple. Predominant. It's right in your face. Okay, and so we think that's probably why if you do one 30-minute session a day, it might counter a little bit of the effect of sitting, but when you've got 8, 9, 10 hours a day of sitting, that 30-minute session can only do so much. And on average, research shows that the typical child and adult will sit maybe 8 hours a day. And there's wide variability there, with some individuals sitting less, some individuals sitting more. So there is an increased focus on sedentary behavior. But there's only been a limited amount of research that's been conducted. and specifically with adults over the age of 65. Also, for individuals over the age of 65, there may be some added negative consequences for sitting too much. And research indicates that sedentary behavior is associated with functional loss and diminished ability to perform activities of daily living. Okay, so that's an added cost to sitting too much. Now, we've tried to increase physical activity levels to counter the functional loss we see when people are not active, but only a small subset of adults over the age of 65 meet national guidelines. And it's been estimated about 8% of adults over the age of 85 are meeting physical activity guidelines. But it's becoming clear that we need to shift the focus from increasing physical activity. Now, let me say though, if you are already physically active, don't stop your activity, okay, to stand up and move more, but add that into it, because physical activity is beneficial. But the problem is if we can't get a large portion of the population to become physically active, then we need to think of other strategies if we want to improve health. So there is a shifting focus from increasing physical activity to decreasing sedentary behavior, and there's a lot of interest in this particular area. So I've shifted my focus. My previous research involved progressive strength training programs using hand weights and ankle weights, okay? And those programs are very effective in countering functional loss. But what I learned from that is there's only a small subset of individuals who are interested in strength training on a consistent basis. So I've shifted my focus, thinking that maybe if we focus on reducing sitting time, we can impact a larger portion of the population. So I began working with Jane Mahoney and Jill Ballard, AKA Jill Rankin, and we started talking or discussing, is there a way to come up with a community-based program that's focused on reducing sedentary behavior? And Jane Mahoney she runs the UW-Madison Community Academic Aging Research Network. And Jill was a community research associate, so she was the bridge between the university and the community. And it's turned out to be a really, really nice working relationship. And what we did is we developed and pilot tested an intervention to reduce sedentary behavior. And because we wanted it to be community-based, we worked with the Rock County Council on Aging, and we actually received some funding from the Greater Wisconsin Agency on Aging Resources to conduct several pilot studies in Rock County. So we conducted one study in Janesville, another study in Beloit, and we wanted to deliver an intervention, and it was delivered as a workshop. And it was designed to break up extended sitting time by standing up and moving more throughout the day. It was delivered as a 4-week workshop. Joyce Lubin, the director of the Rock County Council on Aging, delivered the workshop. And sessions were held once a week for 4 weeks. And the sessions were held at the Rock County Council on Aging building. During the sessions, Joyce provided information on sedentary behavior. She elicited ideas from participants on why they would want to reduce sedentary behavior and how they would go about it in their home setting. She helped them set practical goals and then develop action plans to reach their goals. The participants shared their progress as well as obstacles of participating in the activities that they had chosen to reduce their sedentary behavior. And they shared this with the group, so there was a lot of problem solving, developing skills in order to maintain this change in behavior, that is reducing sedentary behavior. And then they refined their goals and action plans so that by the end of the 4-week session, they got to a point where they had strategies that they knew could be effective for them. This was a research study, so we did collect some data. The outcomes included sedentary behavior, and we collected sedentary behavior by interviewing participants, as well as we asked them to wear monitors, accelerometers. There are different monitors that measure different things, but we asked them to wear monitors to assess both their sedentary behavior as well as their physical activity. And then they completed questionnaires, and specifically the SF-36, because we were interested in different aspects of health-related quality of life. And so the assessments occurred before the workshop started, and then again at 4 weeks after the workshop ended. The individuals who participated in our pilot research had a mean age of 69 years, and at baseline, they averaged high levels of sedentary behavior, almost 11 hours a day sitting. Over the course of the workshop, the strategies that they used most often to reduce sedentary behavior included standing up during television commercials and spreading household chores out across the day. Those were the ones that were used most often, but there was a whole variety. There was one woman who did a lot of cooking, and so she wanted to move more. So she put her spice rack, which was right next to the stove, on the other wall, okay? So there were a lot of different strategies. Also used quite regularly were standing up to get a drink of water and setting a timer to stand up. So we did not prescribe what they should do. We let them pick what would be effective for them in their personal settings. So did these strategies work? Well, yes, we did find significant reductions in sitting time, approximately 60 minutes a day. There were significant increases in light intensity physical activity, and there were moderately large effect size changes in vitality and self-reported physical function. We also wanted feedback from the director of the Rock County Council on Aging, and she indicated that she loved the workshop. She's offered numerous workshops, and she found this to be a very practical, a very feasible workshop to implement in a community setting. And she said the intervention worked because it was simple. It's not complex, and that's the beauty of it. So, with these promising results, we decided to expand the study to multiple counties in Wisconsin. I worked with CARN and state aging units in Wisconsin, and we submitted a grant proposal to the National Institutes of Health, which was funded for a study titled Translating a Stand-Up and Move More Intervention by State Aging Units to Older Adults in Underserved Communities. And we were really interested in targeting communities that contained either small urban settings or rural settings. And so we worked with health directors in Iowa County, Rock County, and Vilas counties. We screened 94 adults over the age of 55 years. And out of the ones that we screened, there were 56 individuals with a mean age of 74 years who were randomly assigned to either the workshop group, they got the Stand Up and Move More workshop, or to a waitlist control. And what that means is they went through their normal patterns during the time the other group was getting the workshop. And then after we were done with assessments for the first round, they then got the Stand Up and Move More workshop. So they got it later. We had excellent adherence. I was so happy. Only 3 individuals dropped out. And we had excellent attendance. I think we had 2 people who missed a session, and they actually wanted the director to give them the information separately. So we had really good adherence and really good attendance. The workshops and assessments occurred in Rock County and Iowa County between March and June. And in Vilas County, Amy wanted to wait until some of the snowbirds came back. So they started a little bit later. Their workshop and assessments occurred between April and July. We expanded some of our outcomes, so we did a few more assessments. The outcomes included participant satisfaction, sedentary behavior, physical function, and we expanded how we wanted to look at function, and we actually used the short physical performance battery, which includes measures of balance, gait speed, and chair stands. We looked at pain levels because one of the things that had been brought to my attention is some individuals were afraid that if they standed up and moved more, it would increase their pain. Because in our previous study, okay, a large majority of participants had arthritis. And so it's like, oh, I don't know, should I do this? I might have more pain if I do it. So we measured pain levels, and then again, we looked at aspects of health-related quality of life. The assessments were completed at baseline, at an introductory session, after the workshop, again, 4 weeks, and then we did a follow-up assessment at 12 weeks. So if we look at participant satisfaction, we asked them how many thought the workshop was beneficial. Everyone. I don't think I've ever had 100% on anything before, ever. So it's like, oh, okay, this is great. They like it. They like it. We asked them what they liked about the workshop, and they said that it made them aware of moving more. It was a non-judgmental, supportive atmosphere. It was an interactive class with good conversation and sharing. The action plans created structure for establishing goals. It improved their thoughts, attitudes, and confidence levels, and of course, treats. We asked them what strategies work the best, and we're seeing some of the same strategies come up. But again, there's a wide variety, but the ones that were used the most or seemed to work the best for them was standing up during television commercials. Also, standing up after reading a chapter of a book was another strategy. Spreading household chores out across the day. Physical reminders around the house, for example, setting a timer. And then many individuals were doing a lot of different activities, and so they decided to stand rather than sit during quilting, sewing, reading, working on puzzles, while talking on the phone, and while paying bills. So again, my interest is, do these strategies work? And we did find significant changes in sedentary time, in the short physical performance battery, and I'll show you these results in just a second. Changes in pain interference and intensity, as well as health-related quality of life. Okay, so let me orient you to these graphs because I'm going to show you the significant results in the next several slides, and they're graphed like this. We've got 3 assessment times. This is before the intervention started, after the intervention, and then at follow-up. Okay, the waitlist control group, these were the individuals who did not get the intervention during that 12-week time frame. They got it afterwards. So they were not involved in standing up and moving more. Those individuals are, the group means are indicated in the tan lines here, okay? And the individuals who actually participated in the workshop are indicated in purple. And if we look at these results, you can see the control group did not change significantly, which you would expect if they're not getting an intervention. They probably won't change unless there's something else going on. But you did not see a change. We did not see a change in their sedentary time across the 12 weeks. However, there was a significant reduction in sitting time or in sedentary behavior at the end of the workshop. So the workshop worked. It reduced their sitting time, approximately 68 minutes per day, which is somewhat similar to our pilot research. However, look at this. This is what I'm focused on now. But I'll show you, though, some other results where I'm going, oh, well, maybe we don't need this much. But anyway, let me get to that in just a second. But by 12 weeks after the workshop had ended, what we see for a lot of behavior, okay, is that it creeped back up. Okay, they started sitting. By the time we got to this point, This was 18 minutes less than where they started. Okay? Okay, so, so the workshop was effective, but do we really need to focus in on long-term maintenance? Okay, these are the results for balance. There were some balance assessments that we did. Again, let's look at the control group. No change in the control group in balance across 12 weeks. However, there was a significant increase in their balance score after the intervention, and look, it was maintained at 12 weeks. So I'm going, what is going on there? But anyway, positive findings, their balance improved. What about gait speed? Again, let's look at the control group, no change. Gait speed improved. Okay, they could walk a short distance faster. So the workshop reduced gait speed, and that was maintained at follow-up. If we look at chair stands, this is the time it took to get up out of a chair 5 times. You can see that at 4 weeks after the workshop was done, there was a significant decrease in the time that it took, okay? There were some differences, there were differences between the two groups across all 3 time points, but it does look as though the workshop was effective in decreasing the time it took to rise out of a chair 5 times. We also looked at pain intensity. And for all of the research that I've done, if we do activity at an appropriate level, whether it's standing up and moving more or high intensity activity, it typically does not increase pain. Okay? That seems to be one of those things that has become ingrained, that if I do activity, I'm going to hurt. Okay? But we've not found that to be the case, but I do have to say it has to be done progressively, and it has to be done at an intensity that's appropriate for the person. Again, if we look at pain intensity, we actually saw a decrease in pain after the workshop. So standing up and moving more did not increase their pain, and to go along with that, we saw similar results for pain interference. There was a lower level of pain interference after the 4-week workshop. Vitality improved in the group that received the workshop. Okay, the significant higher vitality scores after the workshop, which were maintained in the follow-up. They reported on general health. Again, this was improved, much higher after the workshop in comparison to the control group. And again, that was maintained in the follow-up. Now this one let me explain, because for this one, higher scores indicate fewer problems, but it's kind of the opposite of what you would think. We did see improvement. They self-reported improvement in performing work or daily activities due to physical health. You can see after the workshop, it was significantly higher. This is for physical health, and we found the same thing for emotional health. Again, higher scores indicate fewer problems. After the workshop, the group that participated in the Stand Up and Move workshop had fewer problems performing work or daily activities due to emotional health. So, in summary, we found significant decreases in sedentary behavior after the workshop, approximately 68 minutes decrease per day. However, sedentary behavior increased during the follow-up, and at 12 weeks, it was only 18 minutes lower per day than at baseline. Functional performance was improved following the workshop and maintained at follow-up. Pain intensity and pain interference was lower in the group that received the workshop compared to the waitlist control group at 4 weeks. And so again, I think this is an important point, and this is one of the points that I think is a selling point to take this forward, is that people can stand up and move more even if they have arthritis or even if they have some pain, okay? And it shouldn't increase their pain unless they're either doing too much or they're doing something that they shouldn't be doing. There were significant improvements in vitality and general health, as well as fewer problems performing work or daily activities due to physical and emotional health following the workshop, which were maintained during follow-up. So the Stand Up and Move More workshop was effective in reducing sedentary behavior as well as improving physical function and quality of life in adults 55 years and older. So just an aside to these results, when we went back to Janesville, when we went back to the Rock County Council on Aging building for the 12-week assessment, we pulled into the parking lot and this sign was out front. And I was like, oh great, Joyce must have done this for us. But when I went in the building, I said, Joyce, did you put that out there? That's great, thank you so much. And she goes, no, I didn't do it. They share a building with the Rock County Health Department. The health department had put it out there. They hadn't talked with her. I don't even know if they knew we were doing a Stand Up and Move More workshop. But again, the press has picked up on this. And you're starting to see more articles come out about sitting is the new smoking. Get up and move. Okay? Also, I just want to share with you the progression of our research. Today what I did is I presented results from our pilot studies in the randomized controlled trial that was funded by NIH. We are now focused on that 12-week piece. And are there strategies that we can implement to maintain this reduction in sedentary behavior over time? And so we have funding from the University of Wisconsin-Madison Contemporary Social Problems Initiative to compare two strategies to see if we can increase maintenance, I guess you could say. And then ultimately what we want to do is we would like to disseminate and implement this program widely. So we've began discussions with the Wisconsin Institute for Healthy Aging to find out what would be the best way to do that, how to go about that. We've also held some workshops in Madison. We conducted a couple of workshops at the UW South Madison Partnership Office on Park Street for African American elders. And then this summer, and I've seen a couple of the participants who participated this summer in our workshop at the Madison Senior Center. So I want to do a shout out to you guys. Thanks so much for helping. And we're looking at whether or not this workshop, Standing Up and Moving More, has any effect on muscle function and strength, which is related to sarcopenia. As we age, the incidence of sarcopenia goes up. Which is a loss in muscle strength and function as we age. So we're seeing improvements in function. So what's the cause of that? I mean, what's going on there? Are we seeing changes in muscle function and strength? So we conducted a pilot study this summer at the Madison Senior Center. And what I'd ultimately like to do is potentially get this workshop into assisted living facilities where we may see even more of an impact on sarcopenia or muscle function. So I need to acknowledge my partners. This has been a wonderful partnership with multiple people. From Karn, Jill Rankin and Shannon Myers have worked closely with us. From the ADRC of Southwest Wisconsin and Iowa County, Brittany Mainwaring and Valerie Hiltbrandt. Rock County Council on Aging, Joyce Lubin and Lisa Lucas. The Vilas County Commission on Aging, Amy Ryan and Sue Richmond. And then my funding sources, as well as my grad students who have helped me with this research. So, in summary, take-home message, stand up and move more. Thank you.